Pasqua. Hey, good evening, Center for Urban Excellence participants, members. Let me say it right, members. It is good to see you all. Thank you for tuning in for Workforce Wednesday. We have not seen each other since we ended right before the summer, so I hope you all had an amazing, fun-filled, eventful summer. So welcome back. As you all know, we meet every Wednesday from 5:30 to 6 p.m. with a professional who's going to give us information, whether that's on school or job opportunities or career paths, all of the things, all the knowledge that you need to make informed decisions about career, about college, about training. And so if there's any particular guest or school or apprenticeship or internship that you would like to hear from or have more information about, please feel free to send me an email. Anissa at centerforurbanexcellence.org, and I will drop that in the chat. You can also feel free to drop your questions in the chat. And as Dr. Lake-Pascua is chatting, I'll make sure to get those questions to her if she's going through her presentation. So feel free to, again, drop your questions in the chat. We're going to have a firm cutoff at 6 p.m. unless you have some questions. Dr. Pasqua has already said that she is willing to take the time to answer our questions. And so that's always dope. One additional announcement is that, hey, I don't know if you've gone to our Center for Urban Excellence website, but as you know, we have our youth job board, or we call it the youth job spot. Youth job board, excuse me. So go ahead and check it out. There's all sorts of employment opportunities there, internships, pre-apprenticeship opportunities, career fairs. All those sorts of opportunities are listed on the youth job spot. It's not only jobs for youth, but also for adults. So it's titled Youth Job Spot, but don't be fooled. There are opportunities there for everybody and several different industries. So please check it out. Don't miss out. If you need support in applying for position, if you need your resume to be reviewed, if you need some mock interview tips, if you need career attire, you can always check in with myself or Raina, or your case manager. Can check in with an agent, and we will make sure that you get what you need to be successful. So without further ado, 2 whole minutes. I'm going to read in Dr. Lake-Pascua. Listen, that move has helped me. That move has helped me. So I appreciate you, Dr. Lake-Pascua. All right. Dr. Lakethia Lake-Pascua, DHA, has more than 25 years of work experience in healthcare, including extensive leadership expertise in call center management, finance, operation, and quality and patient safety. She's a regional program leader with Kaiser Permanente and serves as a strategic program designer and facilitator for a variety of patient safety programs across Northern California. Come on, Miss Ma'am. Lakethia has a heart to serve and is very active in Solano County, where she was born and currently resides. She serves on the Black Infant Health Community Advisory Board and the Board of Directors for the North Bay chapter of the American Red Cross. In 2003, Lakethia started her own nonprofit organization, Living the Black Foundation. Living in the Black Foundation. Let me put some respect on what you got going on. Living in the Black Foundation International. Living in the Black aims to provide education and resources to the community to help them live prosperous lives. This year, the nonprofit's focus is on young adult career readiness, which includes offering free workshops on interview preparation, resume building, and personal branding. Lakethia regularly volunteers with the Red Cross in her church and is an active member of Delta Sigma Theta Sorority Incorporated. Dr. Lake-Pascua holds a Bachelor's of Science degree in Political Science from San Jose State University, and a Master's of Arts degree in Leadership from St. Mary's College of California, and a doctorate in Healthcare Administration from Capella University. Without further ado, you guys give it up for Dr. Lake-Pascua, and the floor is yours. And we just appreciate you joining us tonight to drop all these good gems that we know are coming our way.
Thank
And so without
you.
further ado, it is all yours. Thank you.
Thank you. Thank you for having me. I'm so excited to partner with Center for Urban Excellence and Ms. Anissa. I appreciate you having me. And give me a thumbs up. Can you guys see my screen, my title slide? All right, all right, all right. Good, good, good. Thank you. All right. Well, I mean, you've heard a lot, but let's start talking a little bit more about me and my journey, and then how I can help you in your journey. But before I start, I want to ask, by show of hands, virtual hands or whatever, how many of you are actually interested in a career in healthcare? Uh-oh, I see one. I see Anissa. I see a thumbs up. So I only see one. How about other industries? Either I invite you to come off mute and share what industry you're interested in going in, or if there's a trade that you're going into, or put that in the chat, or come off mute and let me know. Because it's going to be important as we continue our conversation. What industry are you looking to go into for employment if it's not healthcare?
Tech engineering.
Tech engineering. Thank you, Jaharan. What other industries? Business, finance. Where are my service industry folks? Cosmetologists, nail techs, plumbers, electricians. Any of those? But, okay, business. Thank you, Jada. Business, finance. Thank you, Gianna.
Mhm.
Awesome. Keep those coming. It's going to be very important as we go through my presentation that I understand what your career goals are. And you'll hear that shortly. Okay. I may not see you on the screen. So Ms. Anissa, I need you to help me if you see anything in the chat that I might need to see, but I'll toggle back and forth. So in my introduction, there was a lot about community service. And so I want to start with that. Community service is a huge part of my life. I'm a member of, as it was mentioned in my bio, of Delta Sigma Theta Sorority Incorporated, which is a public service organization. So we do a lot of work in our communities. One of my personal passions is around voter registration. You may not know, as early as 16 years of age, you can pre-register to vote. So if you haven't done that yet, go on the California Secretary of State's office website, and you can pre-register to vote so that when you turn 18, you will automatically be registered to vote. I'm also on the board of directors for the American Red Cross, and we do a lot of work in the community as well. One of my personal passions is organizing community blood drives. For communities of color in particular, we are the #1 affected by sickle cell disease, as well as other healthcare conditions that require blood as a part of our treatment. And as people of color, we are uniquely created. Our blood is uniquely created to support other people of color. So getting that education out in the community is really important. And then the last thing is I serve on the Community Advisory Board for Black Infant Health and for Solano County. So that program exists throughout our counties in California and beyond, and really helps to support Black women who are having babies with resources, parenting classes, and other tips. So the images you see here are me serving in those various capacities, but I mention that also because while you're looking for a job or while you're looking to go to college, volunteering and community service is a very important aspect of your college application as well as your career applications. Organizations want to see how you are giving back to your community. Also was mentioned in 2023, I started my own nonprofit organization. This is my initiation and path to entrepreneurship, which is another thing that's important. I make great money, but it's never enough. So having a path to entrepreneurship, whether that be through a personal business or corporation, as well as a nonprofit, which is really not intended to make money, but really to provide services and resources to others, is another passion of mine that I'm exploring and really is my retirement plan. So let's talk about healthcare. So as was mentioned in my bio, I'm a regional program leader with Kaiser Permanente. And my role, I'm responsible for designing programs to address and support patient safety throughout Northern California in various areas. And so one of the ways in which I do that is through simulation. So in that first image in the top left, you see me with my mannequin. Here, I was at a community event teaching high schoolers CPR. And then with some of our teams, as you see, I've blurred out their faces so you don't know who they are. But some of these images, we actually do fun activities just to get teams connected because that connection helps build communication. And communication is so vitally important to the delivery of patient care. So I am really an educator in a sense. And so how many of you even thought of the fact that educators exist in healthcare? So that's why I ask, what industries do you want to go into? because it's not just doctors and nurses that we need in healthcare. We need educators. So I am an educator. You see some images of me here in the classroom. I also attend conferences where I present on the different work that I'm doing with other healthcare leaders across the nation. So having presentation skills is vitally important as well. In terms of my journey with Kaiser Permanente, the 26 years that I've been employed with Kaiser, I started in the call center. So I don't know how many of you are Kaiser members, but we have an appointment and advice call center. So if you need an appointment with your doctor or a message sent to your doctor, or you need some advice about symptoms that you're having, that's our entry point to care. So I spent 6 years in that role, starting first as a teleservice representative on the phone, which we consider an entry-level position where only a high school diploma is required. I was in college at the time. I was a junior in college at the time, and it was the perfect job for me, very flexible. I worked evenings. The call center is 24/7. So I worked evenings and then worked my way up in the call center up through management, into management. I spent 10 years and I'm currently still working in the quality and patient safety realm, which both at the local hospital level and what we consider our regional or corporate level at Kaiser Permanente. I've also worked in finance. So how many of you, Gianna wants to work in finance? We need people in finance, in healthcare. Healthcare is a big money industry. So we need people with business acumen, with how to understand how to operate a business and how to look at how do we manage our money. So that's why I asked, what industries do you want to go into? And clinical leadership. You didn't hear me say I was a nurse, right? You didn't hear me say that. But I manage nurses, I manage nurse practitioners, medical assistants, licensed vocational nurses as a leader in our women's health and pediatric departments. So leadership is universal and can transcend different clinical areas within healthcare. Leadership skills really are helpful in you growing professionally. And in business, you will learn a lot about leadership, how to talk and communicate with people, how to operationalize results. So we'll have a lot of results in healthcare that we're looking at. Patient safety outcomes. We're looking at how many appointments can we provide to our patients and how do we get those people there into those appointments, and we have enough appointment supply ready for them. Those are all business and leadership skills that are translatable in healthcare. So that's kind of been my journey in Kaiser. And you heard about my education. So when I started with Kaiser, I was in an entry-level role. I had no degrees, but since then I've been blessed actually to acquire every level of degree that I can possibly attain. A bachelor's degree in science, in political science, a master's of arts degree in leadership, and then most recently, my doctoral degree in healthcare administration. So dust settles, I don't. So we keep learning. That's the other thing that you want to make sure that you're striving for education is the point I want to make there. One of the prompts that I received from Ms. Anissa was talking about what are some of the challenges that I experience in my role in healthcare. There's a lot of hierarchy in medicine. So as you can imagine, doctors first, and then everybody else. And so navigating that hierarchy can be challenging. Doctors want to be the authority of all things, but if I am the authority on finance, then you need to defer to me. If you are, the expert in business, they will need to defer to you. And so as an educator, I need to be well-rounded and knowledgeable on what they're doing, not necessarily from a clinical perspective, but how I can help meet a need that they might have or a gap in what they are experiencing in their teams. We're going to encounter personalities. That's a challenge, just like you do in your everyday life right now, whether it's one of your friends or a teacher, professor, or just anyone in your family. We're going to encounter people with challenging personalities, and being able to navigate conflict is very important. You're going to have at times increased workloads. I I worked in a role once where I managed a 24/7 department, and my phone never stopped ringing. And so you'll find roles that are a little more demanding than others in healthcare. Some are banker's hours, Monday through Friday, 8:30 to 5, and some, in a hospital's open 365 days a year. And so at times you'll experience increased workload. And the number one challenge I'll tell you is communication. You would be surprised how challenging it is for people to simply communicate with one another for a variety of reasons. But it is the number one challenge. And I'll tell you some of the ways that I have learned to overcome that is really deferring to the people who have the most knowledge around the work. If you can imagine someone coming to you saying, "Hey, we're changing the way that you do your work, and this is how you're going to do it now," without even asking you what thoughts you might have on what impact that might have to you day to day. So I believe my superpower is that I have the ability to engage teams and say, here's the new expectation. How do we make this happen? What opportunities do we have? There's some non-negotiables. It has to happen. But how will this impact you, and how do we navigate this change? And what I find is by simply interacting with them, I get their buy-in on the change, because essentially they've created the change, right? And it's more likely to be a sustainable change. So one of the things, if nothing else, that you really kind of leave with is understanding the importance of people and relationships. And valuing those relationships in work, in school, and in business. But I wanted to engage you just for a second, because I feel like I've been talking a little bit. And as I was thinking about communication challenges, I wanted to share with you a slide that I actually presented to a clinical team I was working with today, a training that I was doing today, just to demonstrate a little bit about some of the communication challenges we see in healthcare. So I'm going to ask you, as this image pops up, what do you see? There's two images you should see. Either come off mute or type in the chat. What images do you see there?
A girl with like a hat on.
A girl?
Mhm.
Head? Is that
I
what you
see
said?
Yes.
A girl? Okay. A woman looking
Uh,
away.
yeah, I see a woman looking away too, but then it looks like she kind of got an eyeball on the side, so it's a little strange. But it looks like she's looking away.
All right. Anyone
What
else? What do you see? Two images.
I see a girl with I think like a sun hat, I think.
With the sun hat? Uh-huh.
Yeah.
Yep.
Jada, what
Yeah.
about you, or Janaya? What do you guys see? Deanna, anybody else want to share? Lakeisha?
I also see a woman looking away.
Okay. So do you see a second image?
I feel like I got to squint to see.
Jada said, I see a
Okay.
woman in a
Mhm.
beret looking away. So here, if hopefully you can see my pointer here. This is the young woman's side profile, right? I think most of you saw that, and her
Yeah.
ear here, and she has her little hat on. But if you I don't know if you need to tilt your head or not, but there's also an old woman image here. So this is the old woman's side profile. Here's her nose, her chin, and her mouth. Do you see the old woman? No. Anybody see? Yes. Gianna
Oh,
says
I
yes.
see.
You see it?
I don't
Like
know
it's
if that
like
means my
old
vision is
one.
really good or really bad. I don't know what that means.
Anybody still not see it? I keep drawing on my screen. Sorry. Yeah. So there's two images here. Okay. So the next thing I'm going to share, I'm going to pop up. We're going to do this again. Let me just toggle back to my other screen here. Okay. So who's right in this picture? Who's right? Come off
Is it
mute. Type in the chat. Who's right?
yes.
Both of them. Okay,
Mhm.
Satara.
Mhm.
Anybody
Anybody
disagree with
else?
that?
Both.
Both?
Both are right. Yeah, everybody
Good.
says both. Oh,
Everybody says
okay.
both? Okay, great. Okay. And then
Mm,
here's another image. What do you see here?
a duck.
Two things.
I see a head like of
I
a
see
duck.
a duck and a rabbit, I think.
Yep, duck and a rabbit. Everybody see that?
I may need a stronger prescription. I only see a duck.
Here's the duck, duck bill. But if you really look at it another way, this is the bunny ears, and this is the bunny's nose, eye, the bunny going this way. And so I share this with you because I just taught this today about the importance of communication and calling out what you see when you're communicating. So when I had you call out, what do you see in these images? You said an old woman, or you said a young woman, and then I told you there was an old woman. Then maybe the old woman's image didn't pop up at you until I said it, right? Same thing with the duck and the rabbit. And then with the who's right, that can be based on what are we doing? Is this about medication? Then if it's a 6 or a 9 becomes incredibly important, right? If I'm going to overdose you in medication because I saw a 6 versus a 9. So these are some of the real life challenges that folks experience in healthcare every single day. And this is the work that I do with doctors, nurses, technologists, LVNs, et cetera, each and every day as teams to get them to work together and communicate in the interests of our patients. But these are things that in any industry that you go into, business, finance, engineering, et cetera, that you're going to experience those things. So young eyes. I love that. And so the next thing I want to talk about, one of the questions that Anissa wanted me to ask is, what are the perks for working at Kaiser Permanente? Well, the perks, first and foremost, the pay is excellent. You said other than pay, but the pay is excellent. But the other perks are that we receive as a part of our benefits package medical, dental, and vision benefits, not just for me, but for my entire family. Most companies are only providing medical benefits for you as the employee, and maybe will give you a little bit of money on the side to subsidize some of the healthcare for your family members. So this is a huge benefit to have this level of quality of care that Kaiser Permanente provides, provided to you as a benefit for being an employee. All those degrees that I mentioned, one of the benefits that helped me obtain them was tuition reimbursement. So I receive a certain amount of money each year that I can apply towards taking classes, getting my degree, going to conferences. And that is money that is a benefit to me as an employee of Kaiser Permanente. And then you see a bunch of sports acronyms there, right? So Kaiser Permanente provides healthcare for the Valkyries, the Golden State Warriors, and the Sacramento Kings. So sometimes, not all the time, sometimes we receive discounted tickets to attend games. And then I have the Nike swoosh there because one of my favorite benefits that they offer that I haven't been able to activate just yet is that we receive passes to go to Beaverton, Oregon, which is where the Nike headquarters are, and to shop at their shop on the headquarters, at the headquarters site, which in Oregon means no taxes and it's extremely discounted. So it's an excellent benefit. There's a lots of vacation offerings and hotel offerings for being a Kaiser member. Even Southwest has a link for our business travel, which is really nice. And then I have the image of Bottle Rock there because we will often receive discounts to concerts and entertainment because Kaiser is often a sponsor of those events. So Bottle Rock in Napa is really a popular event that Kaiser is always sponsoring. And as a byproduct of that, they pass along discounts to us as employees to attend those concerts. And they're usually really expensive. So having that perk of having the discount is really nice. Let's see, what else do I have here? So I'm going to toggle back to my other screen. Sorry. So what advice do I have for pursuing a career in healthcare? What I want you to know is healthcare is a great industry to consider, and you don't have to be a doctor or a nurse or someone in somebody clinical to do it. Just like any business that exists, we also need customer service representatives. We need receptionists. We need food service workers. We need landscapers. We need painters. We need environmental services or janitorial staff. These are all entry level positions that don't require a degree. Okay. But we also need educators, engineers, IT professionals, finance professionals, human resource professionals, lawyers. We need lawyers, project managers, consultants, and leaders. We need folks who are in managerial roles and leaders that can help lead our operations. So what the advice I have for you is don't limit yourself if you're interested in business and not thinking of healthcare as big business, because it is. If you're in finance, don't negate thinking about healthcare as a pathway in finance, or supply chain is another big industry, because we always need supplies and equipment in healthcare. So supply chain is another great industry to pursue if you're thinking about healthcare. Just as in the hotel industry and all these other industries we're thinking about, I want you to consider healthcare needing those same exact skills and resources. So the other advice I will give you is, if you're looking for an entry-level role in Kaiser Permanente, particularly as a former leader and someone who has hired staff, apply for everything. I don't care if it's temporary, on call, short hour. Apply for everything just to get your foot in the door, because you can only grow from where you start. I think that's the biggest tip. My daughter is actually on this session. She has a medical assisting certificate, and is working for Kaiser Permanente currently. She literally applied for every job that she was willing to commute to. It took a while. I'm not gonna lie, it took a while, even with her mom trying to hook her up on the back end. But applying for everything, and really just saturating that market as you're looking for roles is the best way to get your foot in the door. So I'll stop talking there and take any questions you might have, and I'm happy to again hang on the line if there are more questions. I know we're almost right at time. So what questions do you have for me?
Don't be
Please come off
shy.
mute or put them in the chat.
Great opportunity to take advantage, to be able to ask a professional exactly the questions that you may have pertaining to her career path or something adjacent to it that she may be able to answer. So please don't be shy. I have a question. What does DHA stand for?
So DHA means that I am a doctor in healthcare administration.
Very
So I
nice.
often, just because I'm humble, I often don't refer to myself as Dr. Lakethia Lake-Pascua. I just put those credentials at the end. But I don't like to be redundant and say doctor and DHA. So I pick the other, one or the other.
Yeah. Well,
Thank you.
congratulations. That's no small task. Like, that's no small feat. So congratulations to you.
Thank
It's a lot of
you.
work.
Thank
I have
you.
a question.
Yes.
So I'm the opportunity coordinator with Q. And then I'm taking a course right now to get certified in community health worker. And just curious, what would be like, I guess what I'm asking is, what would be like a good, like maybe like part-time like job, maybe through Kaiser, that you can do like advocating, like, and do like the community work within, and then while I still work with Q, like, is that like an opportunity that you guys have?
So are you speaking about working part-time or volunteering?
Well, I guess like working and volunteering, like whichever
Yeah.
comes first.
So we do have a community benefit arm. So our hospital system
Yes, sir.
is a non-for-profit organization, which means that we're not trying to make money on the hospital side, and we actually give a lot of that money out in the community. So we do have a community benefit department. Which is a part of our public affairs, which does a lot of work in the community, tabling events, just really having our presence in the community. The other thing I'll say, and I'm not too familiar with the certificate you're getting, but we also have a health education department. So if you're someone that has information on and can help provide information into the community about classes that we offer or teach classes, we often will have for new moms breastfeeding classes or Lamaze classes. So if you're a doula, even those might be services that you can help provide. So I think there's multiple ways because we are very much community oriented. We do have a volunteer program as well as at Kaiser Permanente. So that's another option as well. And you can find everything on
Okay.
kp.org.
Okay. Thank you.
You're welcome.
Dr. Pasquale, would you happen to know the age requirement for volunteering in case some of our participants here, our members, would like to participate with Kaiser?
I believe it's 16, starts at 16, if I'm not mistaken. Because we do have a lot of youth that volunteer. You need those volunteer hours to graduate. So we do have a lot of youth volunteers. I believe 16 is the age. I will also let you know that we do have, and you should be able to find this on kp.org as well. We do have summer intern programs that we offer for high school students. We also have administrative fellowship programs for those who have just recently completed college, where those folks have this kind of exposure to healthcare. I started with Kaiser Permanente as a high school intern working in human resources. So that was my first experience with Kaiser Permanente, and it sealed the deal for me. So keep an eye out for that. Unfortunately, if you have family members who work for Kaiser Permanente, you're not eligible. But it really is a great opportunity for you to really get exposure to healthcare or even exposure to different departments. Because it's not just, again, about clinical care. You may be working in a safety role, or you may be a project manager or something like that, or in nutritional services. So it's a great opportunity. But all of those are listed on kp.org.
So thank you, Dr. Lake-Pascua. I have to keep moving. All right. It is 6:03. If you guys have any additional questions, drop them in the chat. But I want to say thank you. Everybody give snaps and claps to Dr. Lakethia Lake-Pascua, who has come this evening and spent her time with us, dropping so many gems. She has shared that she clearly has multiple streams of income, which is a must, and especially if you're going to live in California and with the cost of eggs, okay, and all the things, you definitely need multiple streams of income. Volunteering. One of the things I dropped in the chat is volunteering and networking. They say networking is your net worth. And so as you come to know people, you have references. You might need those letters of reference for college or for jobs. And so get out there and volunteer and build your own network. So that's what you're doing with Q. You have multiple people now that you can call upon if you need additional supports or recommendation letters. Healthcare, she said, not just the clinical side. So you don't have to come in and be a doctor or a nurse or work with patients, but there's so many different things you can be doing. There's finance, there's logistics and supply chain, there's food service workers and landscaping. And so there's something for everybody, right? She dropped in the benefits, which are huge. You should always consider that. Is there PTO? Is there a pension? Is there a 401k? Are you going to get a Nike discount? Are there flight benefits? And so consider that as you're looking for a potential employer. And one of the things she said that stuck with me, she said, you can only grow from where you start. And so she's saying, apply for everything. So leave no stone unturned. And so tuck those gems in, put them in your chain, and keep them. And so again, Dr. Lakethia Lake, thank you so much for joining us on this Workforce Wednesday. Okay, you showed up and showed out. And so I appreciate you. And so we're going to go ahead and close out. If all hearts and minds are clear, if you have additional questions, drop them in the chat. I'll hang back for a second. If not, you are dismissed. See you next week,
Thank you.
5:30.
Thank you.
Thank you. Let me stop recording.